Unit 11 test questions. 61. A nurse and nursing assistant are assisting the respiratory therapist to position a client for postural drainage. The nursing assistant asks the nurse how the respiratory therapist select the position used for the procedure. The nurse responds that the therapist choose a position that will use gravity to help drain which are the following areas. 1. Trachea. 2. Main stem bronchi. 3. Lobes. 4. Alveoli. The correct answer is 3. Lobes. 62. A nurse is preparing to check the breath sounds of a client when auscultating for bronchovascular breath sounds. The nurse would place stethoscope over 1. The peripheral lungs field. 2. The major bronchi. 3. The trachea and larynx. 4. The lower posterior thorax. The correct answer is 2. The major bronchi. 63. The client is being discharged to home after 2 weeks with a diagnosis of tuberculosis and is worried about the possibility of infecting family and others. The nurse provides the most assurance by telling the client that 1. The family does not need therapy and the client will not be contagious after 1 month of drug therapy. 2. The family does not need therapy and the client will not be contagious after 6 consecutive weeks of drug therapy. 3. The family will receive prophylactic therapy and the client will not be contagious after 1 week of drug therapy. 4. The family will be treated prophylactically and the client will not be contagious after 2 to 3 consecutive weeks of drug therapy. The correct answer is 4. The family will be treated prophylactically and the client will not be contagious after 2 to 3 consecutive weeks of drug therapy. 64. A client has had an arterial blood gas sample drawn from the radial artery and the nurse is asked to hold pressure on the site. The nurse would apply pressure for at least 1 minute, 2 minutes, 5 minutes, 10 minutes. The correct answer is 3. 5 minutes. 65. A client baseline vital signs temperature 98°F orally, pulse 74 beats per minute, respiration 18 beats per minute and blood pressure 124 by 76 mmHg. The client suddenly speaks a temperature of 103°F. Which of the following respiratory rate would the nurse anticipate as part of response of body to the change in client status? 1. 12, 2. 16, 3. 18, 4. 22. The correct answer is 4. 22. 66. A client who has an upper respiratory infection asks the nurse why food does not seem to have any taste during illness. In formulating a response, the nurse understands that this due to which of the following? 1. Anorexia. 2. Blocked nasal passage. 3. Fatigue. 4. Blocked taste buds. The correct answer is 2. Blocked nasal passage. 67. A client is experienced to open pneumothorax and sucking chest wound which has been covered with an occlusive dressing. The client begins to experience severe dyspnea and the blood pressure begin to fall. The nurse first should 1. Remove the dressing. 2. Reinforce the dressing. 3. Call the physician. 4. Measure oxygen saturation by oximetry. The correct answer is 1. Remove the dressing.